I'm Julie Barkey with this Senate update. Thousands of Minnesotans find themselves ineligible for health insurance, and Senator Jeff Hayden has a plan to provide a state program to assist them. He explained his bill to us prior to presenting it in the Senate Health, Human Services, and Housing Committee. Here is that interview and some of the debate from that Senate committee. What exactly is the demographic that you're hoping to reach?
You know, it's typically going to be people that are here that are undocumented, so they're not eligible for the public programs. Those folks are here, they're working, along with young people who belong in those families. So we're hoping to enrich the benefit set to take care of those folks that have either chronic illnesses or maybe sometimes have a sudden accident. Those folks still show up at our hospitals, at our major safety net hospitals, and we still care for them. So what we're hoping to do is to kind of offset some of that cost to our local counties who have safety net hospitals.
So is MinnesotaCare and the variety of plans offered on the exchange, is that not an option for this group?
Yeah, that's not an option. As part of the ACA, those folks aren't eligible, unfortunately. They want to be eligible, they want to pay, but the federal law prohibits them from being eligible. So we do have a cost sharing with the federal government that works with the state to put this package together that we call emergency medical assistance, or the uninsured folks. So we are hoping to add more dollars to that to create a richer benefit set. And these are chronically ill people. Sometimes they have cancer or end-stage renal failure, so they're on dialysis or other things of that nature. Or it also could be someone that, say, was working on a roof and fell out and maybe have a spinal cord injury and need services over the long term. Those costs are going to be incurred. We're going to give those services out, and we're hoping to do cost sharing with those counties that provide the safety net service.
You brought up costs, so the natural next question is, what is the price tag for this bill?
You know, we haven't seen the fiscal note yet. We know that it got cut about $15 million in the 2011 session, so that's loosely what it might cost. I don't want to go on the record with that because we don't know, and we got to figure out kind of who and what benefit set we'll give. But we think that it's a relatively low cost because we want to give compassionate care to people, and if we don't pay for it, then the counties do, or whoever runs the safety net hospital.
Are there any questions on the bill from the committee?
There's a slide on page 3. Adults 21 and older, are they not already eligible for public programs or subsidies at the federal level?
Mr. Skandrat.
Yeah, Madam Chair and Senator Benson, the primary group of adults that would not be eligible would be people who are either documented immigrants but who don't meet other requirements for eligibility for medical assistance, or undocumented immigrants in that category.
So,
Senator Benson.
Mr. Chair, so then we go back to slide 2, and it's the 50% in the green, in the pie chart. The green, is that who we're targeting? What portion of the pie chart here are we covering with this?
Mr. Skandrat.
Madam Chair and Senator Benson, yeah, I apologize, it's a little bit confusing. That pie chart shows the total number of uninsured, but that includes people, for example, who choose not to get insurance but could afford it under the eligibility criteria or the affordability criteria for MinnesotaCare. It includes people that are in transition as well. So those that we're would be looking at would be a small portion of the green would be in that category, and then in some way or another, most of the people in the children in the blue 14% undocumented would be covered. The kids, all kids in that piece of pie would be covered, and some of the adults, but only if they have a chronic condition, a serious chronic condition.
And so,
Senator Benson.
Madam Chair, Mr. Skandretti, what percentage of the green? And why just that percentage? They're documented immigrants, they're exempt from the mandate, so what other quality do they have that means they can't get insurance somewhere else?
You mean the people that we're not covering that are in the green?
Right.
Mr. Skandrat.
Madam Chair, get back to keeps rifling through the slides. The documented exempt from the mandate would be, for example, someone whose income is low enough that under the rules for the mandate of coverage, they would not be required to get the coverage. But some of those may have incomes above those thresholds that we're creating here, so they wouldn't even be eligible for these programs. So they are exempt from the mandate for various reasons, which it could be, for example, the affordability, that the cost of available coverage is too high for what the rules would say they can afford to pay. But that doesn't mean that their income would be low enough to qualify, because we have low thresholds for eligibility in these programs.
And
Senator Benson.
Madam Chair, okay, I'm just having a really hard time wrapping my head around numbers. So at some point, I'm just going to want to know numbers. So of the 200,000 uninsured, what number are we going to cover? But I do have a question. Children 21 and under, does that include 19-year-olds, able-bodied?
Madam Chair,
Mr.
Senator
Skandrat.
Benson, that would include anyone that's below that age who meets the income requirements. The kids program would the goal here is to just be able to say to the community, don't delay care or avoid care for your kids. There's going to be some way to cover that care for kids. For adults, again, it's only certain adults who have a very chronic and serious condition that's going to result in an emergency if they do not access care.
Senator Benson.
Okay, so a 19-year-old undocumented shows up here and they get access to health care. Doesn't matter how long they've been here, doesn't matter if their parents brought them over when they were 4, none of that matters. They come here undocumented, they get coverage.
Mr. Skandrat.
Madam Chair, Senator Sharon, yes, this bill proposes that all kids should have access to coverage regardless of those other factors.
And Madam
Yeah.
Chair, maybe we just have a disagreement on what kids are, but at some point, they're not kids anymore. There's, proposals to let people who are 18 years old drink alcohol, let people who are 16 vote, and now we're saying they're children. So, in any case, I'd like to, Madam Chair, ask Mr. Skandrat about adverse selection in the adults over 21. If they are eligible for other programs and simply aren't getting them, and they wait till they get sick, how's that addressed?
Mr. Skandrat.
Madam Chair and Senator Benson, the bill says that this would only cover those individuals or children who are not eligible for any other programs and who have a low enough income that they would qualify, meaning that they probably couldn't afford to buy any insurance that's available to them.
Senator Benson, and then
Madam
Senator
Chair,
Nino.
My last question, how many people?
Madam Chair and Senator Benson, we're currently working with the Department of Human Services to kind of get down to the precise numbers. It's a little difficult because we're in this state of flux where we don't know exactly how many people are going to end up uninsured after all of the rollout of MinnesotaCare and the expansion of Medicaid and so forth. But we're waiting for some numbers from DHS and should have those any day in terms of the numbers in each of the categories.
Senator Nino.
I'm just trying to like Senator Benson, I'm trying to wrap my head around what groups are we getting at here. So if we had, I'm just looking at adults, not children. If we had an adult, 22 years old, that's not eligible for the other state programs, but clearly is eligible under the ACA, Obamacare, to go into the exchange and get subsidies, but has opted not to do that, would they be eligible under the language in this bill or not?
Madam Chair,
Mr.
and
Skandrat.
Senator Nino, they would not. If they're eligible for any other program or to get coverage through MinnesotaCare, this is only at the bottom of those that don't have any other options. And part of the enrollment process would be screening people and making sure that they're directed to whatever other programs are currently available or to get the MinnesotaCare coverage if that's available to them.
Senator Nino.
And, okay, so, and if I'm missing something, certainly enlighten me and correct me. But as I understand So if I'm eligible to opt into the exchange, either state or federal, whatever the case might be, this would not cover me. My understanding is that everyone who is either a citizen of the United States or is here legally is eligible to do that. That would then leave only people that are here illegally. Am I missing something?
Madam Chair,
Mr. Scandrett.
Senator Nino, you're not missing anything at all. This is focused on those people who are here for whatever reasons. And the issue, of course, from the safety net provider community is that when they need health care, they need health care. And also from the federal and state government perspective, we do have a program that the federal government requires us to have to pay for the emergency and hospital and ER care when those people do, regardless of immigration status, when they have an emergency. So we're focusing for that group on, can we spend that money better? Can we provide care before the hospital and after the hospital that prevents that revolving door, what we're seeing currently with those chronically ill people that end up back in the emergency room time and again, because when they're discharged, they don't get the follow-up care for their heart condition or their diabetes or their psychiatric conditions. And so, again, the focus for that population is, can we manage the chronic care better, and it's only available for those who have a serious condition that's likely to result in an emergency.
Senator Nino.
And then I guess this question probably be more for Senator Hayden as the author of the bill. I read through the bill, and I apologize if I missed it, but I didn't see anything in here that specified what kind of cost-sharing levels there would be for these individuals. I think the inference is that this would be either free or very low cost, but I just wanted to hear what is the intent of the author? I didn't see it specified in here.
We are patterning this again after the emergency medical assistance, and it's people who are at 133% of poverty as opposed to the higher levels, so the bill doesn't propose any co-pays or co-insurance for that population.